Good morning, dear student. Today I will discuss for you the subject of antenatal care. This subject will be presented through two lectures. So, antenatal care presented by Professor Dr. Selwa Shalish Abdelwahid. Learning objectives of these two lectures. At the end of this lecture, you will be able to define antenatal care and determine its goals and importance. Another thing, to schedule antenatal visit and main services presented to the pregnant. Number 3, to present common discomfort, relief measures, nutrition during a pregnancy, also main screening program. First of all, we will define antenatal care. Antenatal care is comprehensive health supervision to the pregnant women before delivery. So, we will supervise the pregnant women before delivery in comprehensive way, or its planned examination and observation and guidance given to the pregnant women from conception till the time of labor. What is the goals of antenatal care? First of all, to reduce maternal and perinatal mortality and morbidity rates. Another goals for antenatal care, to improve physical, mental health of women, also her children. The importance of antenatal care, to ensure that the pregnant woman and her fetus are in the best possible health. Also to detect early and treat properly complications. In addition to that, offering education for parenthood. I mean that we will educate the mother how to take care of her coming newborn. Another point, to prepare the woman for labor, lactation, and care of her infant. About the schedules of antenatal care, when the pregnant woman registered in any primary health care near her home, they will schedule for her the antenatal visit. The first visit or initial visit should be made as early in the pregnancy as possible. When the pregnant woman discovered herself as a pregnant woman, so she can go to the nearest primary health care to her home and registered in that primary health care. So they will start the preparation for registration by new files if the pregnant women registered for the first time, or they follow her previous registries in the same primary health care in order to add this pregnancy to the previous pregnancies. What about the return visits? Once every month till 28 weeks. Till 28 weeks, the pregnant woman usually goes one time to the primary health care. After that, 2 visits during each month of the till 36 week. After that, once every week till labor. Frequency of antenatal appointment: nulliparous with an uncomplicated pregnancy schedule of 10 appointments. This is for nulliparous, I mean primigravida. Parous with an uncomplicated pregnancy schedule of 7 appointments enough. Steps of antenatal care services started with assessment, history, examination, and investigation. So, first of all, the doctor or the GP will assess the condition of the pregnant woman, starting with full history about herself, previous pregnancy, obstetric history, menstrual history, family history, and so on. A lot of questions will be related to the history. After that, start with the examination, general examination, and special examination for the pregnant. Follow that, the investigation. What about the history? History, personal history, family history, medical, surgical history, menstrual history, obstetrical history, and history about the present pregnancy. Regarding the fetal kick count, the pregnant women report at least 10 movements during 12 hours. 10 movements during 12 hours. Absence of fetal movement precedes intrauterine fetal death by 48 hours. So, the pregnant woman should be followed her infant movement. If she notices there is no movement, she can consult the primary health care or antenatal care unit as soon as possible. Regarding the physical investigation, the height of over 150 centimeter indication of an average size pelvis. Approximate weight gain during pregnancy 12 kg. 2 kg in the first 20 weeks and 10 kg in the remaining 20 weeks. 1.5 kg per week until term. Examination. Symphysis to fundal height should be measured and recorded at each antenatal appointment from 24 weeks. Fetal presentation should be assessed by abdominal palpation at 36 weeks. Fetal heart should be noticed and followed. Fetal heart sound is heard by sonic aid as early as 10th week of pregnancy. Fetal heart sound heard by fetal stethoscope after 20th week of pregnancy. What about the investigation? Of course, there is a lot of investigation starting with the hemoglobin, general urine, blood grouping, RH. Urine should be tested for ketone and protein. This is very important during pregnancy. We should educate the pregnant women to do many things and to avoid many things. The things that we advise the pregnant women to do to be avoid weight gain, fresh air, sunshine, rest and sleep, diet, daily activity, exercise and relaxation, hygiene, teeth care, bladder and bowel follow-up, sexual counsel, and to avoid smoking, medication, infection, irradiation, occupational and environmental hazard, travel, follow-up, minor discomfort, signs of potential complication. Common discomfort during pregnancy and what is its etiology and relief measures. First of all, starting with urine frequency. There is a frequent urination for the pregnant, which is annoying the pregnant women. So, what about the relief measure? Decrease fluid intake at night. Maintain fluid intake during day. Void when feel and go to the toilet. She also, pregnant, complain always about fatigue. So, we advise her to rest frequently and to go to the bed earlier. Sleep difficulties, decrease fluid intake at night that she can sleep comfortably. Nasal stuffiness and epistaxis, etiology elevated estrogen level. So the relief measure, avoid decongestant and use a humidifier and normal saline drops. Advise her to have humidifiers at night, even through the day, and saline drops to use for decongestant. Ptyalism, which means excessive salivation for unknown origin. So we advise the pregnant to perform frequent mouth care, chew gum, decrease fluid intake at night, maintain fluid intake during the day. Nausea and vomiting, the relief measure, avoid food or smell that exacerbate condition. Eat dry crackers or toast before rising in the morning. Eat small frequent meal, avoid sudden movement, get out of bed slowly, breathe fresh air to help relieve nausea. What about heartburn? Eat small, more frequent meals, use antacid, avoid overeating and spicy food. Dependent edema, avoid standing for long period, elevate legs when lying or sitting, and avoid tight stocking. The pregnant women sometimes complain of varicosity, even if she had no varicosity before pregnancy. So we advise her to raise in Smith's position, as that demonstrated in this slide. Elevate legs regularly. Avoid crossing leg. Hemorrhoid, also another complaint during pregnancy. So the relief measure, maintain regular bowel habit, use prescribed stool softeners, apply typical or anesthetic ointment to the area. Some complication related to the constipation. Constipation one complaint during a pregnancy. So relief measure, maintain regular bowel habit, increase fiber in the diet, increase fluid, find iron preparation that is least constipating. Backache, relief measure. Also, backache is a very, very important complaint, and usually you heard about backache. The pregnant women complain that she had backache all the time. So, what about the relief measures? Wear shoes with low heel, walk with pelvic tilt forward, use firmer meters, perform pelvic rocking or titling. Leg cramp, also another complaint during the pregnancy. Usually you heard about that. So the relief measure, extend affected leg and dorsiflex the heel. Elevate lower leg frequently, apply heat to the muscle. Faintness, relief measure, raise slowly from sitting or standing, elevate hemoglobin and hemocrat, that's by examination of hemoglobin or doing test for hemoglobin, and if it is low, the GB can prescribe ferrosam and other iron compositions to the pregnant woman. Avoid hot environment. Thank you. This is for the first lecture in the subject of, or in the theme of antenatal care. So we'll continue that by the second one related to the screening program during pregnancy. So screening program is the detection of unrecognized condition or disease during any event. First of all, we will talk about asymptomatic bacteriuria. Women should be offered routine screening for asymptomatic bacteriuria by midstream urine culture early in the pregnancy. Identification and treatment of asymptomatic bacteriuria reduce the risk of pyelonephritis. Gestational age assessment. Early ultrasound between 10 weeks, day 1, and 13 week, day 6, to determine gestational age and to detect multiple pregnancy. We can detect multiple pregnancy from the start of 10 weeks. Crown rump length measurement should be used to determine gestational age if the crown rump length is above 84 mm. The gestational age should be estimated using head circumference. Screening for fetal anomalies. The combined test, nuchal transparency, beta human chronic gonadotrophy, pregnancy-associated plasma protein A, offered to screen Down syndrome between 10 week 0 day and 13 week 6 day. This screening test is not available here in Iraq, but could be in the future. They can do it routinely. Screening for gestational diabetes. We should follow or search about the risk factor for gestational diabetes. We will search about gestational diabetes among women with body mass index about 30 kg per square meter. I mean fatty women. Pelvis macrosomic baby weighing 4.5 kg or above. Previous gestational diabetes. Refer to the diabetes during pregnancy. Family history of diabetes. First degree relative with diabetes. Family origin with high prevalence of diabetes. Screening for hematological conditions. Screening for sickle cell disease and thalassemia should be offered to all women as early as possible in the pregnancy, ideally by the 10 week. Anemia screening should take place early in the pregnancy and booking appointment. At the booking appointment, very important, hemoglobin test done routinely to the newly registered pregnant. At 28 week, when there is other blood screening tests are being performed, and at 36 week, normal range 11 gram per 100 milliliter at the first contact. If it is 10.5 at 28 week, should be investigated and iron supplementation considered. Blood grouping and red cell antibodies. Women should be offered testing for blood group and rhesus D status in the early pregnancy, and to give anti-D at 28 week and post-delivery for Rh negative pregnant if a baby Rh positive. Hepatitis B virus serological. Screening for hepatitis B virus should be offered to pregnant women so that effective postnatal intervention can be offered to infected women to decrease the risk of mother-to-child transmission. Hepatitis C. Pregnant women should not be offered routine screening for hepatitis C virus because there is insufficient evidence to support its clinical and cost effectiveness. Rubella susceptibility screening should be offered early in antenatal care to identify women at risk of contracting rubella infection and to enable vaccination in the post period for protection of future pregnancy. The last subject I would like to present for you is the nutritional supplement during pregnancy. Folic acid, very important element, starts before conception and throughout the first 12 weeks. Reduce the risk of having a baby with a neural tube defect, for example, anencephaly or spina bifida. The recommended dose 400 micrograms per day. Vitamin D, women at greater test risk advised to take this daily supplement. These include women who have limited exposure to sunlight, such as women who are predominantly housebound or usually remain covered when outdoors, women who eat diets particularly low in vitamin D, such as women who consume no oily fish, egg, meat, vitamin D, fortified margarines or breakfast cereals. Women with a pregnancy body mass index above 30 kg per square meter. Vitamin A supplementation intake above 700 microgram might be teratogenic and should therefore avoided during pregnancy. Iron supplementation should not be ever returned to all pregnant women. It does not benefit the mother or the baby health and may have unpleasant material side effects, but advised to the pregnant women who have anemia or low hemoglobin level. Thank you. This is for antenatal care. See you in the coming lectures.